Welcome to the Plan B channel, where we provide updated, accurate and unbiased information about HIV treatment. My name is Ben Plumley. I'm a global AIDS strategist and advocate, and I'm passionate about making sure people with HIV get accurate information about HIV treatment so they can live long, healthy lives. In each episode, we tackle one key question, and in this episode, we're going to be looking at the tests, the laboratory tests, that a doctor may prescribe at the start of HIV treatment. And I'm joined by Dr. Royce Lin, an HIV specialist from the United States, who is Associate Clinical Professor at the University of California in San Francisco. Dr. Lin, hello.
Hello, Ben. Nice to be here.
So, what tests, laboratory tests, do you routinely prescribe and ask for your patients when they begin treatment?
Yes. So before starting treatment, there are three main categories of information that I want to know and need to know. The first group is tests that tell us something about the virus and your immune system itself. So one of those tests is something that we call viral load. And a viral load measures how many copies of virus are in a unit of blood, such as in one microliter, milliliter of blood. And the higher the virus, the more quickly the HIV disease is likely to progress. So we also want to know how far has it progressed already. And to know that, we measure something called a CD4 count. CD4 cells are a kind of white blood cells that is part of our immune system. And we want to know how strong or how compromised someone's immune system is at the time of starting treatment. For people who have very, very low immune systems, you may need to take additional medications, antibiotics, to prevent opportunistic infections. One last lab that is related to the HIV virus itself is something called resistance testing. And that's generally what we order, something called a genotype. And this test tells us whether or not the virus has mutations that make certain HIV medications ineffective. So that's one group of labs. As an HIV doctor, I also want to make sure that I select the best combination possible. And to do that, I need to know, are there factors about my patient that I need to take into consideration? So this includes things like, how's your kidney function? How's my patient's liver function? Some medications may cause more stress on these organ systems than others. A final category would be infections or conditions that oftentimes travel together with HIV. For example, sexually transmitted infections and hepatitis. So I will always check for any signs of other infections that may be sexually transmitted, and also for hepatitis, because that has very important treatment implications, particularly for people who have hepatitis B.
Well, wonderful. Thank you very much, Dr. Lin. Well, that's the end of this episode. In a moment, information will come up on the screen telling you where you can find out more news about HIV treatment and information about it in your country, as well as links to contact us, because we would love to know what you have to say and what questions you would like to ask. Thanks for watching.